Anthrax. Anthrax is a serious infectious disease caused by spore-forming bacteria known as Bacillus anthracis. It's one of the most feared biological weapons because its spores are incredibly resilient, able to survive in the environment for decades, waiting to be inhaled. When used as a weapon, inhalational anthrax is the deadliest form. Once inhaled, the microscopic spores travel deep into the lungs, where immune cells pick them up and carry them to the lymph nodes in the chest. Instead of destroying the bacteria, these cells become the perfect breeding ground. The spores germinate into active bacteria, multiplying rapidly and releasing powerful toxins. At first, it feels like a common cold. You might have a mild fever, a cough, and fatigue. But within a few days, the disease progresses into a massive respiratory crisis. The toxins destroy the surrounding tissues, causing severe internal bleeding, swelling, and fluid accumulation in the chest cavity. Breathing becomes almost impossible as your lungs fill up. The bacteria enter the bloodstream, triggering septic shock and spreading the toxins to every major organ. Without immediate and aggressive antibiotic treatment before the symptoms turn severe, inhalational anthrax has a fatality rate of over 80%. During the Cold War, weapons programs optimized these spores for aerosol dispersion so they could drift miles downwind, invisible and odorless, before being inhaled by unsuspecting targets. Smallpox. Smallpox is caused by the variola virus, a highly contagious pathogen that afflicted humanity for thousands of years. As a weapon, it spreads easily through the air via respiratory droplets. Once inhaled, the virus multiplies silently for 12 days during the incubation period. The victim feels perfectly fine, unaware of the ticking clock inside them. Suddenly, a severe flu-like illness strikes, bringing a high fever, splitting headaches, and intense back pain. A few days later, the characteristic rash begins, starting as red spots in the mouth that burst and release massive amounts of virus. The rash spreads to the skin, covering the entire body in hard, round pimples that fill with thick fluid, turning into painful pustules. In its most severe form, known as hemorrhagic smallpox, the virus strips away the body's ability to clot blood, causing massive internal bleeding that leaks into the skin and organs, turning the skin black and leading to death within days. The standard form carries a 30% mortality rate, leaving survivors permanently scarred or blind. Because routine vaccinations stopped decades ago, the modern population has little to no immunity, making any weaponized release a catastrophic event capable of sparking a global pandemic. Botulinum toxin. Botulinum toxin is the most lethal biological substance known to science, produced by the bacterium Clostridium botulinum. A single gram, evenly dispersed and inhaled, could theoretically kill over 1 million people. When used as a biological weapon, it can be aerosolized or used to contaminate food and water supplies. The toxin works by invading the nervous system and blocking the release of acetylcholine, the chemical messenger responsible for telling your muscles to move. Once the toxin enters the bloodstream, symptoms begin within hours. It starts with blurry vision, drooping eyelids, slurred speech, and difficulty swallowing. The physical horror lies in its progression, causing a symmetric descending paralysis that moves from the head down. Your arms lose strength, your torso weakens, and your legs give out. You remain completely conscious and fully aware of what is happening, your mind perfectly clear while your body slowly turns to stone. The true lethality occurs when the paralysis reaches the respiratory muscles, including the diaphragm. Without the ability to expand your lungs, you no longer draw breath, leading to suffocation while fully awake. Survival requires immediate access to an antitoxin and months of mechanical ventilator support in an intensive care unit, which would quickly overwhelm any healthcare system during a mass attack. Plague. Plague is caused by the bacterium Yersinia pestis, the notorious pathogen responsible for the Black Death. Weaponized versions focus on pneumonic plague, the deadliest and most contagious form. Delivered as an aerosol cloud, the bacteria are inhaled directly into the lungs. The incubation period lasts only 1 to 6 days. The illness begins abruptly with a high fever, severe chills, body aches, and a crushing headache. Within 24 hours, the infection severely damages the lungs, causing acute pneumonia. The victim develops a deep, painful cough, spitting up bloody, frothy sputum loaded with millions of active bacteria. Every breath becomes an agonizing struggle as the lung tissue degrades and fills with fluid. The disease spreads with terrifying speed, moving from the lungs into the bloodstream, a condition known as septicemic plague. As the bacteria multiply in the blood, they release toxins that trigger widespread clotting inside the blood vessels. This blocks circulation to the extremities, causing the tissue in the fingers, toes, nose, and lips to die and turn pitch black, literally rotting away while a patient is still alive. Blood leaks from the nose, mouth, and anus as the internal organs fail. If antibiotic treatment is not started within 24 hours of the first symptom, pneumonic plague is nearly 100% fatal, making it an ideal choice for biological warfare programs seeking maximum lethality. Tularemia. Tularemia, often called rabbit fever, is caused by the highly infectious bacterium Francisella tularensis. It is considered an exceptionally potent biological weapon because of its extreme infectivity. Inhaling as few as 10 to 50 microscopic organisms is enough to cause severe, life-threatening disease. When weaponized and sprayed into the air as an aerosol, it causes pneumonic tularemia. The symptoms appear within 3 to 5 days, starting with a sudden debilitating fever, severe chills, muscle aches, and joint pain. As the bacteria take hold in the lungs, they cause a progressive pneumonia characterized by a dry cough, chest pain, and extreme difficulty breathing. The infection causes extensive inflammation and tissue destruction within the respiratory tract, leading to ulcers, abscesses, and fluid accumulation in the chest cavity. Without treatment, the bacteria breach the lung barriers and enter the lymphatic system and bloodstream, spreading to the liver, spleen, and bone marrow. This triggers systemic inflammatory response syndrome and multi-organ failure. The victim experiences profound weakness, weight loss, and a slow, painful decline. While the mortality rate for pneumonic tularemia is around 30 to 60%, its primary value in warfare is its ability to incapacitate a massive number of people simultaneously, crippling military forces and civilian infrastructure. Marburg virus. Marburg virus is a highly lethal filovirus closely related to Ebola, causing severe and explosive hemorrhagic fever. As a biological weapon, it is coveted for its extreme lethality, with mortality rates reaching up to 88%, and its potential for aerosol transmission when modified in a laboratory. The incubation period lasts anywhere from 2 to 21 days. The disease begins brutally and abruptly with a soaring fever, severe headache, muscle pains, and intense malaise. By the third day, the victim suffers from severe watery diarrhea, abdominal pain, cramping, and extreme nausea. The physical transformation is shocking. Patients develop a ghost-like, drawn appearance with expressionless faces, deep-set eyes, and profound lethargy. Between days 5 and 7, the hemorrhagic phase begins. The virus attacks the lining of the blood vessels, causing them to leak uncontrollably. Bleeding starts from the gums, nose, and any tiny breaks in the skin. The internal organs, particularly the liver and spleen, begin to dissolve and fail. Bloody vomit and severe diarrhea filled with blood become constant. The patient experiences severe shock due to massive blood loss as the body's ability to maintain blood pressure. Confusion, irritability, and aggression manifest as the brain suffers from lack of oxygen and internal bleeding, culminating in coma and death, leaving a highly infectious corpse. Ricin. Ricin is a highly potent toxin found naturally in the seeds of the castor oil plant. Turning it into an effective biological weapon requires processing it into an ultra-fine powder that can be inhaled. Ricin works by entering the cells of the body and permanently blocking protein synthesis. Without the ability to create proteins, the cells quickly die, leading to widespread tissue death. If inhaled as an aerosol, the victim experiences a severe cough, burning sensations in the throat, chest tightness, and significant difficulty breathing. The toxin causes massive inflammation and fluid buildup in the lungs, a condition known as pulmonary edema. As the lungs fill with fluid, the body is starved of oxygen, causing the skin to turn blue. Within a few days, the respiratory system fails completely. If ricin is ingested through contaminated food or water, it attacks the gastrointestinal tract, causing severe vomiting, bloody diarrhea, and intense abdominal cramps. This leads to massive dehydration, low blood pressure, and the destruction of the lining of the stomach and intestines. The toxin then spreads to the kidneys, liver, and spleen, causing them to shut down. There is no antidote for ricin poisoning.